We're now joined by Dr. Aziza Cisse and Henrietta Agbenauto. Morning to you both. Henrietta, if we can start with you. You have quite a story to tell about what happened to you. Just tell us what your experience is.
It's actually spanned over almost 2 decades. I'm one of those ladies who started their cycles very young. So by 13, I was diagnosed with anaemia, and that progressed with the symptoms getting worse and worse and worse. I was chronically fatigued, I was yawning, I had issues with my hearing. I think normally people mention the shortness of breath maybe, or they mention brittle, nails and hair falling out. But I had those symptoms plus so much more. And it wasn't until 2021 when I went in for an iron infusion. We were still in lockdown at the time. And I was told that I had fibroids. And basically it was because I had years and years of not taking my own symptoms seriously because I thought they were normal, and not being able to double check what my symptoms were and what that could possibly mean.
So did you try to seek medical help? Did you go to the doctor about it?
I often went to the doctor for my anaemia, and I didn't relate it really to my heavy bleeding. They did ask me every single time, are your cycles heavy? And I would say yes. They would do blood tests. Then it would come back that I was severely anemic, and it was a cycle that just kept on repeating.
So when your blood test would come back and you would be anaemic, what explanation would the doctor give to you about what...
This is a good one.
Yeah, what that might be.
They blamed it on my vegetarian diet initially. So I turned vegetarian when I was maybe 10 years old, and they just said maybe it's because you've got, the heavy periods, and maybe it's because you're vegetarian, but they never investigated further. So, yeah.
It wasn't the diet?
It wasn't, no, not at all.
Dr. Aziza, this story that Henrietta's telling us, according to this survey today, is not uncommon.
Yes, it's not, unfortunately, and there are so many women and young girls, teenagers, who are suffering like this in silence and not realizing, and there are a multitude of reasons, but I'm going to simplify it with a couple of things. One, it's that they've been dismissed, not just by their healthcare professionals, but we also gaslight ourselves and we dismiss ourselves and our symptoms. And particularly if 50% of those who were surveyed said that they've been dismissed in general by their partners, by their family members. It's also the lack of education and lack of awareness. So she mentioned she had no idea. And a lot of people don't know what they don't know. So they don't know what symptoms are not normal. So I'm saying this to anybody who's watching, okay? Please remember this. If you notice that your periods are stopping you from doing your day-to-day activities, if they're stopping you from exercising, going to work, if they're stopping you from living your life, basically, if they mean that you're having to change your period products every single hour, if you're having to double up on period products, if you have to put a towel over your bed to protect your sheets, if you're constantly flooding your clothes, all of these are not normal, but unfortunately they've been normalized, and because of that, you have people who are suffering and struggling and having stories like Henrietta. And the fact is, with those symptoms, often there are underlying causes. So Henrietta mentioned fibroids. So fibroids is when, I brought my favorite prop. Fibroids is when you have growths in and around the womb, and then you can have endometriosis where you have womb lining-like tissue in areas outside of the womb, the ovaries, fallopian tubes, and so on. You can have something called adenomyosis. So that's where you have the womb lining growing into the womb. And then you have conditions like PCOS, hormonal disorders, thyroid disorders. So many different things that we can actually treat.
That's going to be my next question. So you can go and, if the doctor listens to you and you can get investigations, is there then an answer? I know there's lots of different things it could be, but it seems to me that, women that we hear from, there isn't always an answer or a treatment.
Yeah, and I kind of mentioned this before, that unfortunately, in terms of women's health, we don't have enough research, 1 to 2% of overall research for 50% of the population, which is crazy when you think about it, and if we exclude cancer. But there are treatment options. We don't have cures for a lot of these conditions because we don't understand why, but we do have treatment options, and they vary from hormonal medications, painkillers, to obviously surgical procedures and so on. So I think what's most important is for people to realize that there are things that we can do to help manage the symptoms so they don't have to continue. For instance, Henrietta mentioned that she was anemic, because she was losing so much blood. we can give medications to stop that heavy bleeding to help to alleviate those symptoms.
What do you wish you'd done or known sooner, Henrietta?
Honestly, I wish I had the right language to use with the GPs. Maybe I wasn't able to express myself because I did start my cycles pretty young. So as I was growing older, and also, you know, I grew up in the 90s, early 2000s. It was very taboo to talk about these things. And I feel as though I wouldn't have had the right words at that time and wouldn't have felt comfortable. So that's why I think it's really important to have a symptom checker so you understand the symptoms. Like Aziza said, if you don't know, you simply just don't know.
And I wonder if one of the things that lots of women do is we do normalise pain, don't we?
Oh,
and
yeah.
tolerate a level of pain because it's just expected.
Exactly. And also there's this thing where we normalize common symptoms. So just because it's common doesn't mean it's normal. And also just because it's been your normal, so that's been her normal all her life, doesn't mean it's normal. Just because it runs in the family. These things are passed on intergenerationally and they need to change, and through education. This period symptom checker, I'm so excited by it because it means that people will get the opportunity to be validated. Oh my God, so these symptoms are abnormal.
And let me just explain how it works, that you put in your information, you answer the questions, and then that produces a letter which you can take to your GP, which uses the kind of language, the medical language, which you were saying is sometimes lacking. Yeah.
Exactly, exactly. And also, not just that, it also guides you towards the self-help tips and also information about the conditions that I've mentioned, which can help.
Thank you both so much for coming in. Really interesting to hear from you.
Thank you.
That period symptom checker is from the